to find a location near you. Again, I'm going to say it one more time. Go to vaccines.gov to find a place where you can get the shot near you. We're working with doctors, community groups, faith leaders, and companies. Leaders of some of our nation's largest pharmaceutical chains, I said, are standing behind me. They're all stepping up to help more people get vaccinated. Some are offering coupons when people get their updated COVID shots. Get the shot. $5, $10, $20 off your drugstore grocery purchase next time at the same time you get the shot. Some are making it easy for you just to walk in and get your vaccine right away, including on nights and weekends. And others from the private sector are stepping up as well, including delivering COVID treatments right to people's homes for free. Now, what do you do if you think you have COVID? Well, please get tested so you can be treated. We mailed out hundreds of millions of free test kits earlier this year. We had to pause the program because, unfortunately, some of our friends in Congress failed to continue to fund the COVID response. But if you have already used up these free tests, that's okay. We've required health insurance companies to cover free at-home tests, 8 tests per person per month. Folks on Medicare and Medicaid can get free at-home tests as well. And we have made free testing widely available in communities. And then, if you test positive for COVID, get treated. We have amazing treatments available now. They can help stop COVID infections from turning into serious illness. We are the only large country in the world that made Paxlovid widely available for free. You can get it prescribed by your doctor or at thousands of test-to-treat sites or even from your local pharmacist. Pick it up for free at your pharmacy. It's a pill. It's a pill. It's easy. Paxlovid can save your life. It's worth it. And here's the bottom line. Virtually every COVID death in America is preventable. Virtually everyone. Almost everyone who will die from COVID this year will not be up to date on their shots, or they will not have taken Paxlovid when they got sick. We've made the vaccines free and available. We've made the tests free and available. We've made Paxlovid free and available. Please use them. Use them. And encourage your friends and loved ones and neighbors to use them as well. It can save a life. To employers, help your employees get vaccinated. Set up a vaccine clinic in your building. Give people time off to get it if necessary. Share good, clear information, just like you do for the flu shots. To school and college leaders, help your communities get vaccinated this fall. Host on-site clinics before Thanksgiving. And to our friends in Congress, it's time to step up with much-needed COVID funding. Help us stay ahead of the virus and keep our communities going strong with free vaccines, free tests, and widely available treatments, as we've done so far. Some of our friends in Congress say we don't need COVID funding, or they say there's really no reason that the government should be paying for it. I strongly disagree. Strongly disagree. This is a global health emergency. If we really want to put COVID behind us, we have to keep up the fight together. We can't leave people to face it alone. Some members of Congress say they don't want to move beyond COVID, but they don't want to spend the money to do it. We can't have it both ways. The funding we seek is critical to continue the work to develop and purchase the most effective treatments and vaccines against COVID. It's important. It's important. Now I want to speak directly to those with special conditions. New variants may make some existing protections ineffective for the immunocompromised. Sadly, this means you may be at a special risk this winter. So I urge you to consult your doctor on the right steps to protect yourself. Take extra precautions. I also want to say this. As we enter this new moment in the battle against COVID, let's use it to start fresh as a country, to put all the old battles over COVID behind us, to put all the partisan politics aside. We've already lost over 1 million Americans to COVID. Over 1 million Americans to COVID. You know, we can do so much now to reduce the number of people who die from this terrible disease. We have the tools. We have the vaccines. We have the treatments. None of this is about politics. It's about your health and the health of your loved ones. I'll close with this. Over the past 20 months, my administration has left no stone unturned to make life-saving tools widely available and easily accessible. Now, COVID cases are down by more than 80% from when I took office. COVID deaths are down nearly 90%. And now, we're in the longest stretch since the virus emerged, when our hospitals are not overrun with severely ill COVID patients. That didn't just happen. It took a combination of incredibly effective vaccines, tests, and treatments to get us there. One of the biggest public health efforts ever undertaken in this country. But together, we did it. Now let's keep doing it. Let's keep going. This fall, get your COVID shot and get your flu shot. It's simple. It's easy. For most Americans, it's one of the COVID shots per year. Once a year, it's going to be required. And it's the most important thing you can do. So thank you. And now I'll show you just how easy it is to get that shot. You're not giving me the shot.
No, I'm not.
All right. What am I doing? My left arm?
Yes, sir.
All right.
Mr. President, is COVID still a national emergency?
It's a necessity to deal with making sure it doesn't become one.
What's your reaction to the Saudis on oil urging the U.S. not to use reserves?
Sir, do you think it was a
Get your
mistake for New
COVID
York to withdraw its mandate for vaccines?
Say again?
Do you think it's a mistake for New York to withdraw its vaccine mandate for private employers?
No, I don't think. That's a local judgment. Thank you.
Mr. President, what is your next move now that Brittany Griner lost her appeal, Mr. President?
We're in constant contact with the Russian authorities to get Brittany and others out. And so far, we've not been meeting with much positive response. But we're not stopping.
Would you consider dirty bomb allegations from Russia? Do you believe this is the beginning of a false flag operation? Mr. President, on the dirty bomb allegations from Russia. The dirty bomb allegations from Russia as it relates to Ukraine. Do you believe that this is the beginning of a false flag operation? Is Russia preparing to deploy a dirty bomb itself or a nuclear weapon?
I spent a lot of time today talking about that. Let me just say, Russia would be making an incredibly serious mistake if we're to use a tactical nuclear weapon. I'm not guaranteeing you that it's a false flag operation yet. Don't know. But it would be a serious, serious mistake.
Mr. President, is a dirty bomb a nuclear strike?
Thank you very much. We appreciate it. Thank you.